Hi doctors, welcome back to my YouTube channel. Since our season 1 of A to Z series has got a very good response, so here is the season 2. For those who are not aware about what A to Z series is, in this series, in every episode, alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE and solve a few related MCQs. So let's begin with our episode A of season 2, and today A stands for atrophic rhinitis. Atrophic rhinitis is also known as ozena. In the patient of atrophic rhinitis, atrophy of turbinates is seen, and it is more commonly seen in females. Now let's discuss the causes of atrophic rhinitis. First, we have autoimmunity. Second, we have vitamin D deficiency. On third, we have estrogen deficiency. And fourth, we have infection by Klebsiella ozene. While examining the patient of atrophic rhinitis, shrunken turbinates are seen, which leads to roomy nasal cavity, which have crusts in it. So let's understand with the help of this diagram how and where crusts are located. And these crusts later lead to nasal blockage, due to which bad smell from patient is felt, but the patient is anosmia, and this condition is called merciful anosmia, which means the patient cannot smell the bad smell because he is suffering with anosmia. Now moving ahead, let's talk about the treatment for atrophic rhinitis. It is done with the help of alkaline nasal douching, which include first sodium bicarbonate, second sodium biborate, and third sodium chloride. Moving ahead, let's talk about the surgery. There are three types of surgery for atrophic rhinitis. First, Young's operation, second, modified Young's operation, and third, Lawton-Slager's operation. Now let's practice a few MCQs about this topic. First, we have a female patient came with complaints of nasal obstruction, loss of smell and foul smelling nasal discharge. On examination, presence of yellowish green crusts in the nasal cavity along with merciful anosmia is observed. Which of the following additional findings may be observed in the patient? Option A, roomy nasal cavity. Option B, nasal polyps. Option C, inferior turbinate hypertrophy. Or option D, foreign body. So which option is correct according to you? Well, yes, option A, roomy nasal cavity is the correct answer. Moving ahead, let's understand the clinical features of atrophic rhinitis. First, we have merciful anosmia. So what is merciful anosmia? Here the patient himself is unaware of the smell due to marked anosmia. Next, the patient may complain of nasal obstruction in spite of unduly wide nasal chambers. Now let's discuss the examination findings of the nose. What all changes we find in the nose? First, we have the nose is filled with crusts. Second, there is a presence of roomy cavities. Third, we have atrophic pale mucosa. Fourth, we have small turbinates. At fifth, there are paranasal sinuses, small with thick walls. Next, we have atrophic pharyngitis, followed by atrophic laryngitis. So the next question is, which is the condition where surgery is done to partially or completely occlude one nostril? Option A, vasomotor rhinitis. Option B, atrophic rhinitis. Option C, invasive aspergillosis. Or option D, allergic rhinitis. Well, yes, the correct option is atrophic rhinitis. So here is the last question for this episode. A female housemaker arrives with symptoms of nasal congestion, reduced sense of smell, and a dry discharge from the nose that is greenish and crusty. Upon examination, the nasal passages appear spacious and the turbinates are found to be shriveled. Which surgical procedure would be suitable for this patient? Option A, submucous resection. Option B, Young's operation. Option C, septoplasty. Or option D, Vedian neurectomy. So which option do you consider the right one? Well, yes, option B, Young's operation is the correct answer. So let's end this episode with the discussion of medical and surgical management for atrophic rhinitis, beginning with medical management. Alkaline nasal dodging solution. Nasal irrigation with an alkaline solution made by dissolving powder with sodium bicarbonate 1 part, sodium biborate 1 part, sodium chloride 2 parts in 280 ml of water, 25% of glucose in glycerine, local antibiotics, camicetin anti-ozena solution, oestradiol spray increases vascularity, placental extract submucosal injection, systemic streptomycin, potassium iodine. Moving ahead, let's discuss the surgical management. Young's operation, mucosal flaps are elevated to close the nasal cavity. In modified Young's operation, an opening of 10 mm is made and rest of the nasal cavity is closed. Narrowing of nasal cavity, submucosal injection of Teflon, Lawrence Langer's operation, section and medial displacement of lateral wall of nose, insertion of fat, cartilage, bone under mucoperiosteum of floor and lateral wall of nose. So that's all for today's episode. Thanks for watching. I hope you liked it. See you in our next episode, which will be episode B.